Okay. Like I said, we're going to do introductions at the end. However, I did want to start off and just mention some notable partners that we've had in this process. Um, the success of a CHA chip process really needs a myriad of partners from all different sectors. But we do want to notice and thank the listed partners for their steadfast devotion and monetary support of the 2025 to 2027 CHA chip process. We have Antelope Memorial Hospital, Avera St. Anthony's in Creighton, and Avera St. Anthony's in O'Neill, Cherry County Hospital, CHI Health Plainview, Osmond General, Niobrara Valley, and West Holt Memorial, and then also Midtown Health. Okay, so what is a community health assessment and a community health improvement plan? A community health assessment is exactly what it sounds like. It is an assessment of the health of a community. So you may be wondering, how do we assess the health of a community though? First off, we need to identify the community. Are we talking about the nation, a state? Are we talking about a city, a county? So in our case, we will be covering the counties of Cherry, Brown, Rock, Kipaha, Holt, Boyd, Antelope, Pierce, and Knox. So North Central District that our health department covers. I'm going to. Okay. Then within that community, we identify the demographics of the people who live there. So what are their ages? What are their race? How about what are their gender? What's the gender split? What are their socioeconomic status? Are they married? What's their education level look like? So lots of other just indicators on who lives in this community. What do they look like? What is their age? Just kind of getting a good picture of what that community looks like. So when measuring the health of a community, several factors are considered. So we look at their health status. What are people dying from? What chronic diseases are most prevalent in the population? We also look at their health behavior. So what are people doing that impacts their health? What are things that people aren't doing? We also look at their built environment. So what affects the residents, how they live, work, and play in their community? What does that look like? Are there parks? Do they have sufficient schools? What do their schools look like? We also ask, like, what are the strengths and weaknesses of this community? It could be socioeconomic, it could be education. We also ask what factors affect their health and wellness, and these could be social factors, they could be financial factors, they could be education or political factors. If you're looking at the political climate in Washington, D.C., that might be very different than what it looks like in rural Nebraska. So these are all aspects that you could consider when assessing the health and wellness of a community. So I'm sure as you're able to glean thus far, there are a lot of factors and things to consider when you're looking at a comprehensive population level assessment of the health and wellness of a community. And I do want to really stress that this is population level health. So we're not necessarily looking at individuals' health. We want to look at the entire district and all people in that district. So once we have compiled information on the health of the county, or sorry, health of the district, we are then going to get outside partners to come and look at the data. So we really are going to invite a myriad of partners, whether it's school, maybe law enforcement, emergency preparedness, um, hospitals, really just we want to get as many different perspectives, different specialties to look at the data and to help us then move on to the community health improvement plan. And so then we will look at the data and we will identify maybe 2 to 5 strategic priorities to focus our attention and resources on for the next 3 years, and really working at ameliorating these health concerns as a multi-sector group. And that's kind of why we need your help. It really takes a broad net of partners, broad net of specialties, and a broad net of resources to create population level health. It's not something that you could merely say, well, you know, Susie has a runny nose, you go to the clinic. When you're looking at touching the entire population, you really need the resources and expertise of the entire population in every aspect of health and wellness. So I'm sure many of you guys have heard the African proverb that it takes a village to raise a child. But today we are going to say it takes a village to conduct a community health assessment and implement a community health improvement plan. It really takes just as much help as we can get. Kiesa and I, as great as we are, we cannot impact the health and wellness of the entire 9 counties by ourselves. Kiesa, you're great, but we can't do it. We need lots of partners. Okay, so why is this CHA-CHIP process important? It is a decent amount of work. There's a lot that goes into it, but why is this important? Why are we even doing this? So it is an arduous task, but there is good reason to do this. It provides quite a few insights and answers to questions like, what are the health problems of our community? What factors are behind the health problems that we've identified? What are our resources available to address these problems? What are the health needs of our community from a population based perspective? And what can we put in place to address the identified health needs? Also, due to the invaluable insights provided through this process, the state of Nebraska has made the CHA-CHIP a requirement for all Nebraska health departments to be completed every 5 years. You really want this to be updated data, updated information, so you're really current with an understanding of your community's needs. It is also required for all accredited health departments throughout the nation. It is also required by the Internal Revenue Service for all nonprofit hospitals in the US. And hospitals are required to complete it every 3 years in the spirit of collaboration and pooling our resources. And like I said, you really have to have an entire community to conduct this process. The health department has gotten on the hospital's 3-year cycle, so we do it in tandem together every 3 years. And for those who do not work at a hospital or the health department, how can this process and product be of value to your organization and your community and the people that you serve? We've talked a lot about data sharing, but data sharing, it will be a great value to your organization. We'll talk about this a little later, but the CHA data will be electronically available to you and the entire district. Heidi talked a little bit about how we are looking to modernize the CHA product and make the data a little bit more updated and current, so that we're able to fully understand the health needs of our constituents on a timely basis. I would also say, you know, collaborating on health priorities your organization cares about and focuses on. You know, it really does take a village to create population level changes. You know, just in conversation with schools have so much on their plate. You know, they have to do academics, They have to do extracurricular sports. And on top of that, people want schools to help parent, provide mental health needs. They just have a lot on their plate, and schools can be a great partner in this process in that we can assist them with some of the needs that they have, look at gaps in their maybe gaps of resources that they need and whatnot. I would also say resource sharing. So perhaps your organization doesn't work directly with mental health. However, your organization could directly benefit from possibly a resource that our CHIP group worked on, like Credible Minds. So this is an online mental health resource database and has assessment tools. So this could be something that your organization provides your employees. And we know every organization, every employer can benefit from having their employees have better mental health, have better coping skills. It increases the amount of time that they are actually at work, increases their attention span while at work. So there's just a myriad of ways that this process could benefit.
I emailed you back with the.
Sorry, Mike, if you were trying to chat, I muted you. I thought it was just background. Otherwise, feel free to unmute yourself. And then I think, the community would certainly benefit from the community health improvement plan. We have so many resources in our district. Having people work together to focus directly on a health concern, that's when you're going to get the most bang for your buck. That's really when you're going to see population level indicators change. If every organization is doing their own thing, then that's great, but there is also there's such power and progress when we pool together our resources and work as a single unit for a certain population level health concern. And I would also say in rural and frontier areas, we are typically a healthcare or mental health shortage area. So really supporting our healthcare providers to get them what they need, to assist them in their strategies, really benefits everybody. So this is a big process. There's a lot of different components. To ensure that we're completing this process with fidelity and an evidence-based manner, we do work with the Mobilizing for Action through Planning and Partnership process. It's in its second version, so we call it MAP 2.0. And MAP 2.0 breaks down the CHA process into 3 different assessments. The first is the community status assessment, the second is the community partner assessment, and the third is the community context assessment. So the community status assessment is a community-driven quantitative data assessment aimed at understanding the community status. It helps communities move upstream and identify inequities beyond health behaviors and outcomes, including their association with social determinants of health. So really it answers, what does the status of your community look like? What populations are experiencing inequities across health, socioeconomic, environmental, and quality of life outcomes? This is going to be primarily the health department's responsibility. We have been working diligently with My Sidewalk and NALED to create a template for our CHA that hopefully will be used by other health departments in the state. So we're really spearheading this new template and new online forum for community health assessments. This assessment will be available on online. We will have a dashboard for it, and it'll also be available as a PDF. Let me see if I can pull this up. I'll give you a little sample. This is the dashboard, and it will be interactive. So you just have your little index over here. Okay, and then all these graphs and maps are interactive. So if you're from Cherry County and you want to know exactly life expectancy at birth for Cherry County, you can see it's 79 years. Whereas if you live in Pierce County, it's 81. And then we'll have preventative health care, behavioral health, lots of different indicators. And this data is really going to include, you know, some of your national and state surveys and data. So we will be pulling this data from My Sidewalk. Like I said, the health department will be primarily responsible for this. However, we will be working with Tommy George to review all of our to review the child to make sure that we have the correct health indicators, that we're not missing any. That would be very important for our understanding of certain health concerns. He'll be providing an executive level overview. And then the PDF, let me see if I can. And then they are working on making sure the PDF is as usable as possible. Being that it was a template, the PDF generator wasn't quite as, didn't work quite as well as they would have liked or normally, but we will have a PDF of the product. So.
On the two products, I will say, like, your most visually appealing, if you're wanting to like show the data, the My Sidewalk dashboard that is an online link will be your best source for that. But knowing that people have to submit something to the IRS and you kind of need like a point in time, here's the final product. We just want to make sure that the PDF can at least serve as that and is something that you can always keep on file.
Thanks. Okay, the third assessment is the community partner assessment. The community partner assessment is an assessment that allows for all community partners involved in the MAP process to look at their own individual systems, processes, and capacities, and their collective capacity as a network across all community partners to address health concerns. This kind of describes how it describes how to build or strengthen relationships with community partners and organizations by identifying your partner's strengths and weaknesses. It does assess each partner's capacity, skills, and strengths to improve the community health. This is something that the health department and several other partners have already worked on. So this is ready to be launched. NCHG, CHI, Plainview, Avera St. Anthony's, and Osmond General, we reviewed the community partner assessment questions that MAP 2.0 has, and we did tailor them to fit our needs and our culture. So this assessment is ready to be distributed. With this assessment, we need your organization's leadership to complete the community partner assessment. We only need one person from your organization to complete it. The estimated time commitment would be 15 to 20 minutes tops. depending on, if they do have some open-ended questions. They have areas where you can talk about what kind of data you guys have from your organization. So depending on how detailed it is, it will take 20 minutes tops. And we are looking to close the survey in about a month or so. So we would like to get these filled out as soon as possible. It does really help within the other assessments just to kind of know what resources you have at your disposal. Really, when you look at the community health improvement plan, there are a lot of different things that you would like to do to improve the health and wellness of your community. But the first question you have to ask is, what can we do? So this is really helpful for understanding what we can do to move forward. I will also say, as an improvement from last cycle's partner assessment, you wanted almost everyone from your organization to complete it. It was 30 to 40 minutes long. So I will send this out as an email. I'll also include it in the meeting minutes. And partners, if you want to share this link with organizations that you're close to within our district that serve our population, feel free to share. We'll also put this on Facebook and our website. Okay, the final assessment is the community context assessment. This is kind of the big portion that we need the most partner engagement with. The community context assessment is a qualitative data assessment tool aimed at harnessing the unique insights, expertise, and perspectives of individuals and communities directly impacted by social systems, health systems, to improve the functioning and impact of those systems. Specifically, the CCA seeks to understand the strengths and resources in a community to support health and wellness. What are the current and historical forces of change at play in the local community, region, and possibly globally that shape the way that community members interact in their community? What are the physical and cultural assets in the built environment, and how do those vary by neighborhood? What steps are being taken in the community to improve health outcomes? What solutions has the community already taken? And to glean this information, we plan to move forward and get this information specifically from our community members through key informant interviews, focus groups, and a brief community-wide survey. So within the community context assessment, the roles and responsibilities for the key informant interviews are really, we want to form a work group to kind of spearhead this. Like I said before, this isn't something that the health department wants to just do and not get partners' insights on it. We know our community pretty well, but Mr. Haley, Cherry County much better than we do. So we really want our partners' insights, their suggestions when we look at how do we talk to our community, what are the best community members to talk to, what questions should we ask, when is a good time to host a focus group, how's the best way to distribute a community survey. These are all things that will vary depending on what county or town you're in. So we really need partner insight and expertise on this. So the community context work group will finalize the questions And we'll need partners to identify key informants and support any kind of interview that's conducted. For the focus groups, the work group will finalize the questionnaire. We'll need partners to help identify individuals and support the focus group as needed. NCHD, we would like to facilitate all the focus groups just to keep a little bit of consistency with the questioning and the way questions are asked. And it'll just kind of help with making sure that we are able to record the responses in an accurate and consistent manner. The community level survey, we'll want the work group to finalize and distribute the survey to partners. Partners will really need help making sure the survey is available in your community via your website, your waiting room, maybe sent out to your staff members, really whatever works for your community and your organization. So for this community context work group, we are seeking volunteers. And like I said before, we will be finalizing the questions that we ask for key informant interviews. We'll be finalizing the questions for the community survey and the focus groups. In the group, we'll also set expectations for the distribution of the community surveys and participation in key informant interviews and focus groups. I would estimate that the time commitment would be maybe 2 to 3 hours. I'd like this to be conducted in 1 to 2 meetings tops, really just to gain consensus on these are the populations that we need to focus on to glean insights, and these are the questions we need to ask. So, for example, the work group may decide, last CHA-CHIP process, we saw that the people or the groups with the lowest health indicators were the elderly. We had Native American, Hispanic, and low income. So maybe this is maybe the work group wants to focus specifically on those populations, maybe trying to get an interview with somebody of Native American descent. Maybe we want to do a focus group at a assisted living. So these are all just different directions that the work group could go, but we do really want insights from our partners to kind of solidify the needs and also what can we do? What do we have the resources to do? So do I have anybody who would like to volunteer to be on the work group? If you do, please just volunteer in the chat. Kiesa, she'll go and mark whoever wants to be on the work group on the Google Doc. So then I'll know who to directly email. I'm looking at having the meeting August 22nd around 10 o'clock. That's a Thursday. It's in 2 weeks' time. If that time doesn't work for the majority of the people, then I can send out a doodle poll and we can find another time or date. But I do think having it in a timely manner will benefit the process. And as I mentioned before, we will have an evaluator, Tommy George. He might be on. I actually hope he's not because he's vacationing in Greece right now. And he said, well, send me the calendar invite and I'll see if I can jump on. I'm like, well, Tommy, if you are, I'm going to ask you to turn your camera on so we can all see the beautiful country of Greece. But I don't think he made it on. Understandable. If I was in Greece, I probably wouldn't either. But he is an independent contractor, and he'll provide a review, his evaluation, expertise, and executive summary for the CHA process. Some of these, like the community survey and the focus group questions, we will likely send those to him once we've decided on what we'd like to ask. We'll send them to him to see if he has any input on maybe changing some wording or whatnot, just kind of get his eyes on it. And Tommy works with Lincoln Lancaster, and he's previously worked on CHAs and CHIPs quite extensively. So he definitely has expertise in this field. Here is sorry, this isn't the best image. Here's a tentative timeline. We would like to get the community context, focus groups, key informant interview, all that data. We really like to have that done by August, September, or I guess done by beginning of October-ish, because that kind of information will go into the online community status assessment. So we will send the entire product to Tommy, our evaluator, around November 1st. So I'd really like to have all the results from our community partner assessment and our interviews, our focus groups, have all that information and data compiled to send to Tommy on November 1st to really be included in our dashboard so he's able to see the product as a comprehensive whole. And then we would like the final evaluation and Tommy's thoughts and whatnot by December 1st. That'll give NCHD some time to look over it, change anything that he might have suggested. The final CHA should be available by February 29th at the latest. So, and then as I mentioned, in the spring of 2025, we will have a presentation of all the community health assessment data. And at this time, we'll invite partners and we'll look at the data and select strategic priorities for the community health improvement plan. So the date has not been selected for that. However, it's typically in March or April, sometimes in the spring. So really just some keys to success for this process is really having our partners attend the CHA data reveal and CHIP priority selection meeting in the spring. We do really want as many eyes and ears on that as possible. As I mentioned, the community partner assessment, we need your organization's top administrator to complete this assessment. Hopefully, the goal is before September 8th. This is something that Kies and I will look at and kind of glean the results from and add that into the community status assessment. And then just keep an eye out for emails from the community context assessment work group. They will be distributing the community survey link. Also keep an eye out for focus group dates, locations, and times. We might be sending emails requesting assistance getting the word out, maybe even supporting the focus group through maybe it's a location, maybe if anybody can provide food, that always helps people show up. And really just, getting people at these focus groups, sometimes an email or a flyer from the health department might get a few, but if really if people from the individual towns and communities and organizations reach out and say, hey, Mr. Wakefield, I know you would be great at providing insights on X, Y, and Z. They're having this focus group. I think you should, attend. They'd really benefit from your perspective. So I think at the end of the day, population health is really our goal, but to achieve population health changes and outcomes, we really do need like grassroots individuals to make that happen. So that's really where partnerships really come into play, and we're just happy to be able to facilitate the process. Do we have any questions?
Whitney, good job. No questions.
Okay.
Do we have anything that makes people nervous or uncomfortable with how we're going forward with the community health assessment?
I think it's really great. It's just kind of figuring out how in the next months to be able to help with this stuff, because I think my experience would be awesome to help. What this next month is going to be kind of busy, so we'll see how it all works out.
Jackie, we can work around your schedule.
Jackie, one thing I will say too is I know you personally, so I know you have a lot of connections in the community, and even taking the time to send like our community-wide assessment to like 3 people that you think would have great feedback, that's a great contribution to the process.
Just finding people, Heidi, is what you're saying?
Yeah, so a part of this will be approximately a 10-question survey that we'll want community members to complete. And that's a space like you would have a lot of connections there on people that would have interesting perspective on what would improve health from a community level. So it doesn't have to be like a huge effort. Taking the time, taking 5 minutes to send that email would mean a lot to us at NCDHD and would help our process.
So just coming up with possibilities. Yeah, that is my gift. I always try to get other people to do stuff.
This is Valerie, and I'd say that I'm very impressed with the My Sidewalk or your contracted service and the data that would be available and compiled. I think that's a great asset for us. So I thank you for that.
Yeah, that's going to be huge.
Yeah, well, I would say Heidi was the visionary. She was the one like, I think it'd be cool if our data was online. And I'm like, what? So yeah, we're excited for the new dashboard. And like I said, I think it'll be just a great way to keep updated data at our fingertips at all times, because I know just even me with like grant writing, I've gone through our old CHA and like pulled certain data points, but you know, if it's fixed in time, then it still creates more work to go and look up updated data sources. So
And to that point, we know a lot of you guys on this call also write for grants. So I can tell you, like Whitney and I, when we're writing grants for the health department, this is the first place I go to like gather what I'm putting in the background that describes our community and the need. And we hope that this is a document that it can continue to be current and can help you guys in that space as well. Also, I think Natalie, you guys were unmuting and I talked over you. I apologize. Maybe it's just me, but I can't hear you.
yeah, Natalie, we're not able to hear you guys.
Looks like she's typing in the chat.
I guess I would say for the community context assessment work group, we had Valerie volunteer, Lon, and Diane and Connie Peters. I know Kelly Dempster with the health department was planning to assist. If anybody else can join, I also might be sending individual emails to request you're present. So, let me see. Kiyosa, do you have everybody's sign-in information? Everybody?
I think I'm still missing a couple of people. I sent a direct message in chat to you guys if and then there's a phone number. I'm not sure who the phone number belongs to. So if the person with the phone number could let us know, it's the 402-690-3079, and then Stuart Nurse 11. I am not sure who that is.
Well, do we want to go through and do introductions real quick so everyone knows who's on the phone? I will have Valerie, do you want to just start yourself off real quick and introduce yourself?
Valerie Wecker, Director of Mission at Avery St. Anthony's Hospital. This is probably my fourth round of CHOD-SHIP, so would appreciate anybody assistance getting on the work group. Thank you.
Okay, and then T. Booth. Sydney,
Can you hear me?
we can.
Okay, good. I didn't know if other people were having issues. I am Sydney Danker with Central Nebraska Community Action Partnership in the Outreach Department. This is my first time sitting in on a meeting like this, so this is all new to me. I handle primarily adults, and this is a huge concern of mine with my clients. Margie Pete is also with me. She's with Central Nebraska Community Action Partnership as well in the EDN Early Development Network. And this is her first time attending too. So this is all very new to us. But thank you for inviting our agency.
Thanks so much for attending. Okay. And how about Shelby?
Yeah, Shelby Reagan. I work for Holt County Economic Development as the director here. We serve countywide across Holt County. Any other, I guess this would be my second CHOD-SHIP I've attended.
Thank you. Sarah Stanislav?
Hey everyone, Sarah Stanislav. I'm on the Healthy Communities team for CHA Health and support the Plainview Hospital. This is my second round of CHNAs.
And I think we have Natalie Ward is present. I think they were having some audio issues, so not sure who else is with Natalie. Natalie, I'll email you. And then Misty?
Raleigh with Bright Horizons. I'm program director for the Ainsworth and O'Neill offices, and this is my second round.
And Minnie?
Hi, good morning. Minnie Sauser, CHI Health Plainview. I'm our Vice President of Patient Care. And this will be my first round.
Well, welcome. And Mr. Haley?
Hi, I'm Mike Hawley. I'm the superintendent with Valentine Community Schools. And this is my first go around. And Lon?
Yeah, Lon Knievel, Administrator, CEO, Osmond General Hospital in Osmond, Nebraska. Kind of been on this from the beginning. I don't know, Valerie, is this 4 or 5? I lose track. But yeah, I've been doing this for a while now.
Okay. Kayla?
I'm Kayla Fisher. I'm the Dean of Students and Athletic Director at Rock County Public Schools.
Kathy?
I am Kathy Norby. I'm CEO at Midtown Health Center. And as I put in the Slack, I'm incredibly late, but we have the Joint Commission visiting us this morning. So I'm a little scattered.
No worries. And Erica?
And maybe I should add too that I've been on the fringes of this in the past, but have not worked directly at this level with North Central, but I'm excited for the process. I've been involved in some other places where we also serve.
About Erica?
Hi, I'm Erica Tubbs. I'm a PA with Greater Sand Hills Family Healthcare in Bassett, Stewart, and Atkinson. And this is my first time attending a meeting like this as well. Thanks.
And Erica works with the Holt Boyd Collaborative as well. Elizabeth?
Yeah, I'm Elizabeth Parks, and I'm the Assistant Director, Epi Coordinator here at NCDHD. I've been here for about 10 years come December, and I've been helping CHOP off and on during that time, so.
And then Diane Blair?
Hi, I'm Diane Blair from CHI Health in Plainview. I am the Community Benefits Coordinator and Executive Assistant here. I'm wondering if the number that you see is it Connie Peters. I did put her on the list. I knew she was calling in.
Thanks, Diane.
Yep.
And then Courtney Hannafeld?
Hi, I'm Courtney. I'm the Director of Nursing at Avera Creighton Hospital. This will be my first round doing the CHOP.
Welcome. Let's see. And then Ryan?
Ryan Orrock from Cody Kilgore School District. I'm the superintendent here.
Thanks for jumping on. Danielle, do you want to introduce yourself?
Sure, I'm Danielle Messler. I'm the Emergency Response Coordinator here at North Central District Health Department, and I've been here about 2 years and have never helped with CHOP, so this is my first time.
Amy, do you want to introduce yourself?
Absolutely. Good morning, everybody. I'm Amy Lotzel from North Central District Health Department. I'm the Environmental Health Coordinator, and I've been here for almost 4 years. It'll be 4 years this month, so happy to be on.
And then Lisa?